Hi guys, so in today's lecture we will talk about tuberculosis. In tuberculosis we particularly talk about mild grade fever with evening rise. Why this evening rise? This evening rise is not because the bacteria becomes romantic in evening hours. This evening rise is in fact due to physiological variation of body temperature during morning and evening hours. In evening hours temperature is higher as compared to morning hours, and this bacterial infection adds few degrees to already increased temperature during evening hours, resulting into subjective feeling of fever, particularly during the evening hours. And apart from these constitutive symptoms, patient also suffers from night sweats, weight loss, lack of appetite, etc. Okay, so let's talk about tuberculosis in detail. Now let's talk about HIV and TB co-infection, that is typical mycobacterial infection. We have already discussed that if you happen to encounter a patient of TB, always rule out HIV. If you are dealing with a patient of HIV, always rule out tuberculosis, active as well as latent. Try to understand, if a person is suffering from HIV and you happen to diagnose that this person is HIV positive, simultaneously you also detect that this person is having active form of tuberculosis. Now you need to treat this patient. You have to start ATT first. After starting ATT, after 2 weeks, then you can introduce ART, not before that. Okay, so in this particular case I am talking about typical mycobacteria. Okay, that is by Mycobacterium tuberculosis. Start anti-tubercular therapy first, then after starting anti-tubercular therapy, then after 2 weeks you can add antiretroviral therapy. This will actually prevent a dreaded complication by the name of IRIS, that is immune reconstitution inflammatory syndrome. See, if you happen to give ART first, it will reconstitute the immune system. It will start increasing the CD4 count, and if bacterial load is high, immune response will increase. Therefore, there can be temporarily worsening of symptoms in case ATT and ART are given simultaneously. Therefore, you have to give ATT first to decrease the bacterial load. Later on you can introduce the ART after 2 weeks of the initiation of ATT. Okay, now one thing has to be noted: in case of HIV positive patients, even latent tuberculosis, even dormant tuberculosis has to be treated, because it can anytime flare into active form of TB. Therefore, isoniazid preventive therapy has to be given for the period of 6 months. That is monotherapy with isoniazid for the period of 6 months. Okay.